Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about advice to brand new medical coders on how to increase your production and speed. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. I have been a medical coder for over 10 years. I really love to share all of the tips and the tricks and all of the stories that I've experienced in my time as a medical coder with all of you. So in hopes that it will help you to better understand our chosen profession and what we do. So if this video helps you, I hope that you will share it at the end. I hope you'll hit that like button, and I hope that you'll subscribe so you can see more. All right, now let's get into it. Okay, so you are a brand new coder and you have that daunting task of now you got to show production. You've got to increase your speed. How do you increase your speed? How do you get to go from, producing like just a few per hour to the standard production of what they are requiring of you per hour? Now, the production standards are going to vary by facility. It's going to vary even by the setting that you are in. I'm going to just talk about the outpatient setting because this is a setting that I've worked in my entire career. So inpatient is going to look a little bit different because what they look at is going to be a lot more. And as far as like they're looking at the entire record. For the outpatient setting, we are looking at the encounter that happened on that day. All right. And that is how we are getting all the information that we need to code. So how do you increase your speed? Maybe you're afraid that you can't make production. Maybe you feel overwhelmed with the thought of having to complete 10 or 12 or 15 per hour. Like I said, the average is going to be different everywhere you go. The good news is if you're brand new, anytime you start a brand new job, every new medical coding job that I've had, I've always been given a ramp-up period. Now, what is a ramp-up period? Ramp-up period is just like it sounds. You're going from the low to the high, and you're going to be able to have time to start meeting production, getting used to the systems and things like that. So you're not going to just be dropped into the deep end of the pool on this one. You are going to be given time to build up, okay? At least this is majority of the time. All right, and then the next thing is you have to learn to trust yourself, and you have to learn to not second guess yourself. That's number one. Number two, don't overthink. Overthinking ruins everything, okay? Don't overthink, whatever you do. Now, yes, there's going to be times when you're not going to be really sure and you just don't want to just fly through the encounters because you don't really know. Take your time, but trust what you've been taught. And if you haven't really had like the hands-on teaching from a teacher, maybe you learned on your own. And so being in the real world is a lot different, right? So it is going to take some time, but it is possible for you to pick up speed. You just have to concentrate. You have to concentrate. You have to not overthink, and you really have to go with your first instinct. Whatever you think your first instinct is when it comes to picking out a code, you need to go with it. Don't sit on the fence wondering if you should or you shouldn't, because every time you do that, those precious minutes are going to tick by, okay? Now, yes, you may have to reach out for help, or you may have to do some research on the internet. If you can absolutely not find a code that makes sense, right? Say, for instance, you're using the encoder. That's the wonderful thing about the encoder is that it does help. However, with the encoder, sometimes if you're putting the information in wrong, it can give you the wrong code. So if the code doesn't look appropriate for the encounter that you're coding, you can look it up on the internet and see what the internet has to say. You can say, what is the ICD-10 diagnosis code for whatever? And then usually it'll come up with something, okay? And it doesn't necessarily mean that this is the correct answer, but you can look up those and see which code best fits, okay? If you absolutely cannot get the answer. And you can go about it that way. But always just sort of keep a good cadence with whatever you're doing and just keep going, whatever the case may be. Do not allow yourself to get distracted. This is very easy in the beginning, okay? Sometimes, and it's going to depend on where you're working. If you, aside from the pandemic, when you are back in the hospital or the doctor's office or whatever the case may be, You may be in a room full of people, or you may be in a little corner desk and you've got a lot of stuff going on in the back. You can put headphones in, okay? I do honestly recommend headphones, especially if you are in a room full of people. And if you have these headphones on, it will help you because then it can keep you focused on what you're doing. Sometimes you may have to listen to classical. I've had to do that before. When I'm not really trying to listen to words, I need to concentrate on what I have. I'll throw on classical. And then sometimes I will have the words. It depends on what mood I'm in and depends on how proficient I am with that particular clinic. So that aside, have some headphones handy, okay, if you are in a room full of people. Stay off your cell phone. I know this seems very common sense, but believe it or not, people are still guilty of this. Cell phones have destroyed the work environment, honestly, because of the simple fact that people have them and they're readily available. There's Instagram, there's Twitter, there's Facebook, there's all of these, Snapchat, all these apps out there that are so tempting and so distracting. But you know, oh, I'm just going to check a text message or whatever. That text message could be 5 or 10 minutes. That's one chart or one encounter, okay? Or it's 2 encounters that you could have reviewed during that time and coded out, okay? Stay off your phone. They're not paying you to be on your phone. They're paying you to work. And I don't care what other people are doing. Well, everybody else in my environment does it. Doesn't matter. What matters is you. What matters is your production and how well you are coding. Because you can't put yourself on the same level as everyone else. You want to go for that high caliber coder status. And even if you are brand new, it doesn't matter because you're learning all the time. Now, veteran coders sometimes get very complacent with what they're doing. And sometimes they're guilty of this. They'll be like, oh, well, I already know what I'm doing. And they just sort of coast along. And they don't really stretch themselves as far as like trying to learn more or trying to be more detailed. I've seen coders do this. Don't be that coder, okay? Be the coder that is trying to learn what they can and moving forward and doing those things in a timely manner. You know, that you're really working on your time and your speed, and you're really trying to remember these things. Because after a while, reading these things and reading the rules, it's going to get quicker because you're going to be able to recall things much more faster. But you have to concentrate on yourself. Ignore the environment around you because that environment around you is what is going to steal your time to code. Now, yes, there's going to be people that may say, oh, well, hi, how you doing? And they may want to chit chat and talk with you. I'm not saying that you can't talk, guys. If they say good morning, of course you want to say good morning, hello, whatever, good afternoon, whatever. You can say those things, but you really do need to concentrate on what you're doing. And then if you have a question, then that's something different. If you're going to your lead or if you're going to your supervisor, whoever you have to go to for your questions, that is something different, okay? Because that's not a social call. That is like that you're you're asking a question. But always try to do your own research before you try to reach out for help. Because yes, new medical coders do get this. They do get where people are looking at them to see how dedicated they are. And if you're not trying to get the answers on your own, you're just constantly reaching out for help and you don't want to do this and I don't understand this, so I don't want to do it. That's not the way to be. You have to face these more difficult charts head on, okay? If you have a chart that is really difficult and you're a new coder and you're working on this, perhaps you work at a level 1 trauma hospital, okay? You work at a level 1 trauma hospital and you have a record that is just multiple injuries, multiple things going on, and it's taking you a while. Make sure that you keep track of that time. Stay focused on your work, and then if it takes you a really long time, let your supervisor know or let your lead know, hey, I had this one, it had a lot of injuries on it. I'm just letting you know it took me a little bit more time. This doesn't mean that you don't have to make up your production later on, because you will be able to. But as long as you are staying focused, at least this way, your supervisor or your lead will know that you're not just goofing off, that you had a really serious chart that really needed your attention. Now, don't do this for every single chart. You know, oh, this one was hard, this one was hard, this one was hard, and then by the time you know it, it just sounds like you're making excuses. That's not the case. These things happen. I had one, my personal best was 32, 32 diagnoses. And this was when I worked for a level 1 trauma hospital. So it was really bad. I mean, it was a lot. It was a lot of procedures. It was a lot of, you know, a lot of diagnoses and things that were going on in this particular record. And this particular record had been skipped by many coders because they didn't want to deal with it. But skipping records is a whole nother episode. But I just want to let you guys know that you have to be willing to face these difficult ones head on. It did take me time, that one. So I did tell my boss, hey, I had this one. And she was like, oh, okay. So she did deduct time that day so that I didn't, my production didn't suffer. But she's like, that's really unusual. And then we did have a meeting the next day about people skipping charts. So, because there was no reason that I should have had that one, but it's all right. I still did it anyway. I mean, because that's what I do. You know, I'm going to go in for it. You know, I'm going to make sure that I code all of these records that are in front of me. And, you know, if I have some hard ones, I have some hard ones. You know, if I get easy ones, I get easy ones. And it balances out. But you have to be willing to take the good with the bad, whatever you do. Don't do the skipping of the charts or, you know, trying to push those over. If it's taking you a long time and you need to just put it aside for a minute, you can do that, but you need to come back to it, okay? You need to come back to it when your head is better and more focused, and make it the same day, guys. Don't try to just leave it for the next person because you wouldn't want that to be done to you. I'm just saying, okay? So, to review, trust your teaching. And don't second guess yourself. That right there is going to really take a lot of your time because there's going to be a learning curve. There's going to be a time that, yeah, you're not going to know everything. And then you're going to learn something and you're really like, oh my gosh, I was doing this wrong the whole time. That's going to happen. But the important thing is to learn the lesson and move on. That's what you want to do. That's the whole goal, okay? We are learning every day. I'm 10 plus years in, like I said, and I say this all the time, and I'm still learning. And there's stuff that, yes, just by reading, like over the weekend, when I read on the weekends, that's what I do. I read on the weekends, and then that's when I start learning even more. If you are in a specialty clinic, it would be a good idea. It would behoove you. It would really behoove you to review everything you can about your specialty clinic. The little bit of time that you invest to learn more about your specialty, either by going to websites that are dedicated to explaining better the disease process of that specialty, the better off you'll be when you're reviewing these charts. The more you know, the faster you will get. It's going to take a little bit of investment, and it's just a little bit. It's not a whole lot that you have to, like, oh my gosh, I got to spend 10 hours a night studying this stuff. No, guys. It's just a little bit. And just being consistent with reading more is going to make your production and your speed a lot more quicker because you're going to understand the diagnosis process. You're going to understand, or the disease process. And then you're going to understand with the procedures. So just investing those things so that way you know what you're reading is going to make your speed and production go up, okay? So really stay focused on that. And then by the time you know it, it'll be so much easier, so much faster for you to get through those records rather than sitting there trying to struggle. The ones that I see that struggle the most are the ones that don't want to do the extra steps of reading or researching. They don't want to do that. They want to do what's in front of them, and then that's it. They don't want to try to do the next step, which is to really understand. Because there's a huge difference between coding from somebody that is just trying to push codes through versus somebody that's looking at the details and being like, okay, this and this and this, and this diagnosis that the provider tried to select is actually a symptom of this other diagnosis, so I don't have to pick this up. So there's all of those other things as well. But that is going to come with time. Everything is going to come with time. It is not going to be that you're going to just produce a bunch of records overnight, or that you're going to be able to be this top speed coder, because it's more about the quality rather than the quantity. I would rather, if I was a supervisor, I would rather have quality over quantity. Not that you need to go really slow, but at the same time, you can go at a decent pace, but make sure that the quality is there. Always quality. That's what you're going to look for. And if a record takes you a little bit longer, it takes you a little bit longer. Not all records are going to take you a long time. Some are going to be very straightforward. Every visit is different, but like I said, some are going to be very straightforward and you can just get through those very quickly. Okay. And then the better trained the provider, and of course this comes later on when you start developing your relationships with your providers, the better relationship you have with them, the more clear the documentation will be, the faster you can get through it. And that's the difference between somebody that will communicate with their provider versus one that will not communicate with their provider. Now, I know in every facility it's different. Some facilities, they have a hands-off approach with the coders, and they have only one person communicating with the provider and not the coders. The coders are just meant to do the coding. Personally, I think that it would be better if the coders were actually doing the communicating, but I understand everybody has a different process. But you're the coder and you're actually seeing what is actually happening with their documentation versus somebody that is sort of just a liaison. And while they may know a lot, the person that's going to know the habits of the provider is the coder. So that is why I always say it's more important for the coder to do the communicating. And if not, then the coder really needs to communicate with that person that is doing the educating for the provider then. So that way that there's a good sort of communication there. So that way the message can be brought forward. Okay. And that's all I got to say on that one. But yes, it's just going to take time, guys. Not everybody starts out so quickly. But always concentrate on your accuracy above everything else. Don't go so slow that you are, not meeting production. But always show that you're trying to improve, okay? Stay off your phone. Get rid of any distractions that you have. Because at the end of the day, you are being paid to work, not be on the phone. And like I said, I don't care if there's other people on the phone. I don't. I would rather people be working and doing what they're supposed to do, okay? Because the more distractions you have, the harder it's going to be to meet production, okay? So it's more important to meet production than to do all that other stuff. The other stuff can wait. It can wait till your break time, or it can wait till lunchtime, and then you can do that then. But from those hours, you need to be dedicated to what you're doing and what you have in front of you. So at least that way you can make sure that all of your attention is focused on where it needs to be. So that is my episode for today. Just very sort of straightforward advice. I mean, because at the end of the day, that is all you can do with it. And I'm very old-fashioned, so I'm going to take the old-fashioned approach on a lot of things, and that is one of them. All right, I'm going to wrap this one up. So if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. I will see y'all next time. Bye!